Now let us start with the autonomic nervous system. This is what is most important of in the exam, autonomic nervous system. Now autonomic nervous system, is it a part of central nervous system, peripheral nervous system? We'll try to see it in a quick detail. Yes, central nervous system is in the center. Brain and spinal cord are central nervous system, and whatever nerves are arising, those are peripheral nervous system. Which nerves are arising? Cranial nerves and spinal nerves. Did you understand this much? Now in the peripheral nervous system we have two types. One is sensory, the other one is motor. Sensory nervous system will sense the information, motor nervous system will send the signals. Yes, now if these activities are under our control in the motor nervous system, if the activities are under our control, let us suppose I want to wave my hand, I can do it. This is happening with the help of somatic nervous system. So this is voluntary. Now if I ask you to increase the acid production in your stomach, if I ask you to contract the muscles of iris in your eyes, all of these are motor functions. Can you do it? No, you cannot, because these are involuntary. So in the motor nervous system, if it is voluntary, we call it somatic nervous system. If it is involuntary, we call it autonomic nervous system. So involuntary activities are controlled by autonomic nervous system. Given in the name autonomic, autonomous, it is doing it automatically. Yes, that's all. Now, if you understood this much, unfortunately, this autonomic nervous system is again divided into parasympathetic nervous system and sympathetic nervous system. Now, in this, you can study it in the anatomy, obviously, but the most important thing that I need right now for pharmacology are neurotransmitter and receptors. See, I told you all the effects come from the receptors. Now, on the receptor, what should act? In the body, we have something known as neurotransmitters. Neurotransmitter means it is sending signal from the nerves. It will act on the receptor and you will get the effect. Now, what is the neurotransmitter in parasympathetic nervous system? It is acetylcholine. What are the receptors? M and N. You must be knowing this. Quick revision for you: muscarinic receptors and nicotinic receptors. That's all. Now, coming to the sympathetic nervous system, what is the neurotransmitter here? Now, there are many. First, we'll try to see the main one. The main one is norepinephrine. What are the receptors? It is alpha, beta. For now, please try to understand this. Now, if you understood this much, you can see this nerve is arising from the brainstem. From the brainstem, if it is arising, this is cranial nerves. You already know parasympathetic nerves origin is craniosacral. In cranium, it is 3, 7, 9 and 10. It could be either 3, 7, 9 or 10 nerves. Let us suppose this is third nerve. So let us suppose it is sending the signal, oculomotor nerve is sending the signal. This signal will be transmitted here with the help of neurotransmitter. And this is ganglion. On the ganglion, there is a receptor present, and receptor will send the signal again, and it is going into the organ. Oculomotor nerve is supplying which organ? Obviously in the eye. So eye has a receptor. Again, this neurotransmitter will work here. Now, what is the neurotransmitter? I have already told you, it is acetylcholine. What is the receptor on the eye? It should be muscarinic. So muscarinic and nicotinic receptors. Please try to understand this much. Now, one more important thing is nicotinic receptors are divided into two: NN, NM. NM means neuronal. It is present on neurons. M means muscles. It is present on muscles. Which muscles? On skeletal muscles. Now, skeletal muscles are voluntary. So, it is present in somatic nervous system. This is what I want you to understand. So, muscarinic receptors are anyways present in the parasympathetic nervous system. Now, NM receptors are present on somatic nervous system. Now, NN receptor, it is present on the neurons, and in between the neurons we have ganglions. So, anywhere we see ganglion, NN is present. You can see here the receptor is NN because it is present on the ganglion, obviously. Now, wherever you see muscarinic and nicotinic receptor, the neurotransmitter always has to be acetylcholine. This is what I want you to understand for now, okay? Now, about the neurotransmitters and receptors of sympathetic nervous system, we'll see all of this before starting the sympathetic nervous system chapter. For now, please try to remember this much. I told you acetylcholine, muscarinic and nicotinic. Nicotinic is again divided into NM and NN. NM is present on somatic nervous system. So you can see this nerve here. In this nerve, does it have a ganglion? No, there is no ganglion. This nerve ends on the muscle. On the muscle, what is the receptor I told you? On the skeletal muscle, we have a receptor that is NM. So this is supposed to be somatic nervous system. In somatic nervous system, also the neurotransmitter is acetylcholine. So this is what I want you to remember for now about the parasympathetic nervous system. Yes. Now, going to the functions of these systems. If you know the physiological functions of these nervous systems, you'll understand almost all the uses and side effects of the drugs. So let us go through this in a quick detail. Yes. No. About eyes, parasympathetic nervous system. See here, what is parasympathetic nervous system doing? When is it used? It is a rest and digest system. Parasympathetic is a rest and digest system. That means it helps us in resting and digesting our food. So let us suppose when you're resting, what do you want to happen in the eyes when you're resting? Let us suppose you want to sleep. Yes. Do you want your pupils to become smaller, or do you want your pupils to become wider and look at everything? Obviously, you want your pupils to become smaller. That is what is known as meiosis. So what is happening? There is meiosis in the eyes. Now, coming to the salivary gland. So we are going from top to bottom. In the eyes, there is meiosis. Now, coming to the salivary gland, for digestion, do you want to increase saliva or decrease it? Obviously, increase the saliva. So, what is parasympathetic nervous system doing? It is increasing the secretions actually. Now, even in the stomach, it will increase the gastric secretions, especially HCl. So, it helps in the digestion. Yes. Now, it will also help in the secretions of other glands also. So, in the eyes, you will also see lacrimation. Now, coming to the bronchus, when you are resting, do you want to take in lot of air, lot of oxygen, or you want to take in some amount of oxygen that is enough for your body? Obviously, some, no, or common sense. So, if you want to take some amount of air, do you want the bronchus to become wider, bigger, or smaller? Yes, small bronchus is enough to take some amount of air. So, there is bronchoconstriction. That's all. So you understood, it is causing secretions, increased secretions everywhere. Now it is also causing bronchoconstriction. Now, if you want to digest the food, do you want the food to move from mouth into the esophagus, into the stomach, into the intestine? Yes, obviously, for all of this has to happen, there should be peristalsis happening. So stomach should contract and intestine should contract. Only then the food will move forward and it will be digested. So it will increase the contraction of stomach. It will also increase the contraction of intestines. If there is peristalsis, if there is movement, it will cause defecation. So all of these will lead to defecation. Same thing with bladder, it will increase the contraction. I told you it is increasing all the secretions and it is also increasing the urination. Next, about the heart. I told you it is increasing the secretions everywhere. Now, where is this parasympathetic doing the relaxation? Obviously, it is relaxing our heart. Now, this is blocking the SA node and it decreases our heart rate because you know SA node is the pacemaker, and it blocks our AV node and it will decrease the conduction. That's all. So these are physiological functions, no need to mug it up, easy to understand. In the eyes there is meiosis, in the eyes there is lacrimation, and it will also cause accommodation. Accommodation is used to see whenever we are having objects nearby. You would have studied it in ophthalmology. Yes, so there is meiosis, lacrimation, accommodation. Next, coming to the salivary gland, it increases the salivation. Bronchus, you don't need a lot of air, so there is bronchoconstriction. In the stomach and intestine, to increase the peristalsis, there is contraction, and then there is also increased HCl secretion. Now, coming to the bladder, increased contraction and it will cause urination. So, defecation and urination. In the heart, finally, it relaxes the heart and it decreases the heart rate and it also decreases the conduction. Now, simple to understand. Now, when do you want to urinate and defecate? Obviously, when you are resting. Yes, when you are stressed out, you don't want to defecate. Yes. So, that is about the parasympathetic nervous system. Now, if you want to understand in bit of detail, you'll understand in sympathetic nervous system. Now, you can see here what is happening. Sympathetic nervous system is a fight or flight system. Parasympathetic is rest and digest. Sympathetic is fight or flight. So, you have to choose whether you have to fight or fly, or obviously you cannot fly, run away from the situation. So, what is happening? We'll see. In the eyes. So, when you're running away, do you want to look at everything? Yes, obviously you want to look far away, no, so that you don't fall somewhere. So, do you want the pupils to increase in size or decrease in size? Obviously, increase in size. This is what is mydriasis. This is what is mydriasis. Now, coming to the salivary gland. When you're running, do you want to salivate all over? It doesn't look good, isn't it? So, there is decreased salivation. What about bronchus? Do you want to take in a lot of air when you're running? Yes, you need a lot of air. You need a lot of oxygen. You want to increase your ATP. So, there is bronchodilation. Now, what about the stomach? Let us suppose you're running somewhere, yes, and if you increase the contraction, it will cause defecation. Do you want to defecate and urinate when you're running away from the tiger? Obviously, no. So, it will cause relaxation. It will cause relaxation of stomach and intestine. And in the bladder also it will cause relaxation. So, there is urinary retention. If you understood this much, what about the heart? Obviously, when you're running, you want to increase your heart rate, isn't it? So, that is what this is doing. It increases the heart rate. It increases the conduction. So, that's all about the parasympathetic and sympathetic nervous system. If you see, sympathetic nervous system functions are exactly opposite to the parasympathetic nervous system. Simple to understand. When you're resting, what will happen? Meiosis, bronchoconstriction, salivation, defecation, urination, and then there is bradycardia, that means decreased heart rate. Exactly opposite in the sympathetic nervous system. People try to remember by this mnemonic. It is very famous. They call it dumbbells. I don't know the exact spelling. It varies, depends on situation. Dumbbells, they call it D for defecation. Yes, we have studied. U for urination. Yes, we have studied this. M for meiosis. Yes, B for bronchoconstriction. B for bradycardia. E for emesis. Emesis meaning whenever there is increased secretions, the secretions will come out of the mouth. That is emesis. Now, L for lacrimation. So, in this there is only one L. L for lacrimation. S for salivation. These are the functions we have studied.